Betty here from RK Radio na let's go hapa county ya St. Gisho side za Huruma and I have the organizers of this event nataka ujitambulishe kuanzia this side to this side
Good, thank you very much RK Radio. My name is Johannes Mosbe. I'm the Principal Programs Officer, Department of Health. Thank you.
Nico Ground. My name is Dr. Paul Wangwe Ongeti, Chief Officer, Preventive and Promotive.
Okay, my name is Dr. Evans Kiprotich, the Director Health St. Gisho.
Leo ilikuwa iko event ya wanaume basically. So the chief exact. Can you tell us more about today?
Yeah, basically today is a men's health day. This is a camp which is actually aimed to target the men within the locality. And the county basically chosen to Huruma because of the vulnerability and the state. Here in Huruma we have a good number of populations and mostly men are just within us. And men for a long time, they've never had a camp which they have their needs being captured. But the county of St. Gisho, led by our Department of Health, came up with this idea, and we feel that we really need to target these people. And basically, the things which are done here are to do with men. And you know, men's health is what all of us, we say when the men are healthy, even the society is healthy. And the same case, the family. So that being said, let me leave it to my bosses so that they can also expound on this. Thank you.
So, we all know what has been happening around the nation. Kumekuwa na femicide for the past few months or so. Kumekuwa na femicide for the past few months. And men wanna feel they are left out. So what are you telling the men when you wameapia leo?
Men are men. That most of the time they lack behind in a number of things here and there. If you look at most of the attendance in most of the hospitals, you realize men are less than the women. Even if you consider women who are not coming with their children, and compared to men, very few men come to the hospitals. I don't know whether it's socio-cultural purely or something like that, or they like staying at home much more until the condition probably is much more worse. It's when they appear in the hospital. Now, in this thing, when it comes to the femicide, you know, the scenario we are facing in this country, men have been quiet. And this is the time you are telling men now they need to come out, protect the child, the woman. Let them be heard. That is basically abnormal. It's not monthly to kill a woman or something like that. And they should be there to stand with them and walk with them the journey. Right from home, wherever they walk, even in risky environments, we encourage men to be there to stand with the women. Just like most of the time, women stand with their men all through. If you realize a man is sick in the hospital, there is a woman, standing together. But when you get women in the hospital sick, most likely another woman could be sitting or at the standby to be there. So let men also learn to stand for women. Just like today we are talking about men for men. We've seen women here also. It means they cannot allow their men to come alone. That becomes a challenge to us. Next time when you have a women activity, men should be there. Thank you.
So the turn-up has been big. I've seen large numbers. So do you think men wametokea venye mlikuwa mna-expect?
Thank you very much. Today is Men's Health Day. There is usually poor health-seeking behavior from men around the county and around. That's a global issue. Men are usually, for whatever reason, not interested to go to hospital or have to be forced to go, or they only go to hospital when things are very bad. But today we have decided as a county under the leadership of His Excellency the Governor to approach men and reach out to them and encourage them to be tested. For example, the PSA testing, the prostate testing. What we have seen is very large numbers from morning, and we know that we have managed to achieve our objective. because we have been busy from morning and the numbers are very high. So we see that what we expected has been achieved.
So SHA is here and people are registering for SHA. Kuna watu wenye wanaogopa wanasema tuliambiwa ni scam and all that. So what do you have to tell people about SHA? Because there are people who are still in fear. Wataki kuregister for the SHA. What can you tell them?
At the moment, SHA is operational and SHA has already been established. We have moved from NHIF to SHA. Registration of SHA is by dialing *147# and you can do self-registration. SHA is Social Health Authority, which has 3 arms in it, which is the Emergency and Critical Care Fund, Social Health Insurance Fund, and the Primary Healthcare Fund. So these 3 are the ones that currently handle healthcare needs of the populace. So I would wish to dispel the beliefs that people have. It is free to register SHA. The premiums are very low, 300 shillings per month. Once you register, you can access emergency care services and the primary health care fund for free. Also emergency services within 24 hours in our hospitals for free. It is not a scam. Let us dispel the rumors and let's believe in it and work towards having a better healthcare in Kenya.
So does SHA has any age limit or ni ya kila mtu?
Ni ya kila mtu.
Watoto kwa wazee kwa mama all?
Yes.
And what do you have to tell the men who are here today?
Yeah, basically our men or our colleagues in the we want to appreciate them. As you can see, we have a very long queue there, which comprises of our men, and we thank them and appreciate them because most of them have chosen the call and they have heeded our request to join us for their own well-being. So we are so glad they are here. They have been patient. They have really waited in the long queues, but we want to appreciate also them because they took time and they were patient enough so that they can access these services. So we appreciate the men fraternity. Thank you for turning up.
We all know men don't talk that much, So to the men who are here today, do you have something to tell them? To the men who are here, Because tumesema wanaume kuongea ni ngumu. To speak up, it's very, very hard. Napata large percentage they are suffering from mental health issues. They are fallen into depression and so on and so on. What do you have to tell your fellow men who are suffering but hawajatokea leo?
Let me say that men have learned the act of persevering, majorly at home, even in silence, without telling anybody, to the extent that if you hear of even the femicide activities going on, these could be men on depression. These could be men who are suffering somewhere silently without saying anything. So at the end of the day, you might realize a number of those who use drugs could be men. A number of those who are serious alcoholics could be men. A number of those who take poison. In fact, the statistics here shows those who want to take some drugs or medicine to kill themselves could be men. The proportion could be higher than those for women. If you look at those people who now stay until it's very, very late when they are very sick, almost if it was something to be stage, we call it stage 4 assuming that stage 4 is ours. The men could be the people who are coming a bit late. Because this man was created to feel that being a man, you need to be strong. Being a man, usilie. Being a man, don't tell your problems to women, for example, or even to fellow men. So at the end of the day, you find out that this particular man has some mental related issues. He's suffering, but in silence. By the time you see the signs and symptoms of that depression, that stress in their minds, it's a bit late. So you regard this person so mad, because kills himself, becomes an alcoholic. Most of those who take alcohol here, naturally are men. So we want to tell the men to come out. Let us face facts are there, and then we have remedies. Talk out, come, we have counselors with us. Even if those who are drug addicts, we can still manage them because it's possible. So there are so many avenues for handling all those sorts of conditions. Call it medical, call it socio-cultural. There are alternatives to management of this. So let them come. We are ready for them here. Okay.
So should we expect another event for the men? Should we expect another event for the men, or ndio ya kwanza na ya mwisho ama kuna zingine zinakuja?
Let me say that this is the beginning. And whenever you start something, you may not tell the end. But from the look of things, it's like men have, their needs are quite relevant for us. If you look at what we used to consider as health, we used to consider majorly a mother and a child as the major things which, most of our planning used to circulate within men and within women and children. Men, we tend only to consider maybe prostate cancer when you are quite old. Maybe the community around here could probably be circumcision related issues because it's part of right. But the rest, what are we doing about the men? Now we are starting to think. This alcohol, how are we going to handle this? Now, what about these people who come? Men, even if their urine, they are not passing urine, there is obstruction, blood outlet obstruction, which is there. They will come when the urine cannot go out. So they are suffering, they come, they start seeing us, and now we realize majority of them, they are starting to get information about it. We're trying to overcome the stigma related with maybe conditions which when men are get affected, they don't want to be exposed. They're now coming out. HIV testing used to be purely women come and be tested for HIV. Currently, if you go there, you realize there are long queue also of men wanting to know their status. If you go to our HIV clinics there, we now have men who are there. So we are encouraging them. This is the beginning. We will also follow them up. Obviously, we have another medical camp next week. On Sunday, we shall be doing it in Sports Club. It will be for all people, men included, children included, women included, young people included. So men would still be there. But this one unique. We are now thinking, can we do it? Can we make it an yearly event? Can we make it at all sub-counties to be carrying out the event? We will be discussing this in our postmortem meeting just after this. Maybe on Monday or something like that. Yes.
So we will be waiting. So these are the people who organize this special event.